The motivation to do this interview really stems from some of the issues that happened early on with my father and his illness, and then again with my mother and her illness. And my father, having been so devoted to the hospital and so devoted to all these issues, has made us sort of want to come forward and just tell the story about how it felt and how that continuity of care was fragmented along the way. There were several hospitalizations, there were several trips to the ER, there were many trips to her oncologist, and that was staggered with trips to her primary care physician. And as a family, we never really knew who was sort of the contact person. Do you call the cancer specialist? Do you call the internal medicine doctor? Do you call the urologist? And it was hard for us to know who to call or who was really paying attention. For example, we went on many trips to the gynecological oncologist, and they would give us a handout, and we would have to go through it to check the medications. And every single time we went, the list of medications was outdated by over a year. And I would change it, and then I would make the changes. The next time we came in, it was the same list. And I would finally ask the secretary, or not the secretary, the medical assistant, this never gets changed, and it really concerns me. I mean, it sort of made me think, is there a centralized electronic file that all the doctors are reading? It doesn't instill confidence that all of her information is in one place. It may be, but I didn't know that. I think we always felt that the attending, her internist, was communicating with whoever else was involved. What I think we were concerned about was the residents on the floor. There's so much turnover, and I know that that's something that's just the way it is. But every time you get used to somebody, then there would be a new person. And no, we didn't feel that things were consistent and that there was much knowledge passed from one person to the next. Well, it was very frustrating. I mean, it made us feel frustrated, and it made me feel like I couldn't leave her. In trying to keep her independent, I needed to look at this whole palliative care issue. Well, I don't even really know what that entails. And nobody brought it up with me. Nobody told me about it. What does it mean? What is the process? I called somebody at the hospital that I know, and I said, what should I do? What's the best thing for me to do? I'm really at a difficult stage with my mother's care, and she needs more help. She doesn't want it, and I don't know what to do. So she said, she gave me the name and the number of some of the palliative care group here at Mass General, and I called. And really what I wanted to do was a fact-finding mission. I wanted to know how to handle my mother. I wanted to know how to handle these issues, how to make the best decisions for her. I was asked, what's the patient's name? And I told her. I said, but she won't be at the meeting. It's just for me and my sister. And she said, well, she has to be at the meeting. And I said, why? And they said, because we don't know how to bill it. Well, I kind of got frustrated with that, and I thought, I don't want her at the meeting. I could have paid for it myself, but it just was a stumbling block for me, and it deterred me, so I hung up the phone, and I just, tried to deal with things the best I could. And during some of my mother's hospitalizations, I think it would have been very helpful for somebody to really approach me and say, we need to sit down and talk about these issues. It was almost like they were more focused on transitioning her from the hospital back to wherever she was going, home, nursing home, or whatever. But it wasn't a program, there were no goals, and I didn't know how to really ask for that. When my mother actually did die, in the morning of Friday morning, it was several days before her death certificate was signed by the people that needed to sign it. And as a result of that, her cremation was delayed, which was very hard for me. That was a hard day when I knew that was happening. And when that got delayed, I was just angry because they hadn't signed the death certificate. I thought that that was irresponsible and just not a caring thing to do. So then when it finally did get signed, I got copies of it, and it was the wrong diagnosis on the death certificate. And that, at the time, infuriated me. And then it was several weeks before that got corrected. And that was very upsetting to us. I would say that overall, the medical care that she got was superb. She loved her doctors. She would never have been comfortable anywhere else. What was really exciting for us in that last hospitalization was that there was a covering doctor, and he kind of jumped through hoops for us. And then another one sort of appeared, and then another one kind of appeared, and we were really excited by that. We thought, you know, here is a situation where we're just at death's door and so upset and didn't know what to do, and then all of these wonderful doctors sort of come out of the woodwork. She had an ID fellow that kept coming up to see her, and I thought he was fantastic. And then she had some of the internists on the floor were great. It was somebody that had been on call for her doctor before, and he remembered her, he knew my father, and he was just right there for her. And those are the types of things that really made it nice for us and for her. She felt very confident in the people that were taking care of her. So for us, that was a wonderful thing to have happen, and it would have been nice if, to some level, we had that level of confidence throughout her care, that there was a little bit more consistency of care. We hope that somehow our experience will make it better for others.